My name is Chee Pui Mun. I am from School of Physics, a first-year student with major in Applied Physics. My role in this group is as an editor.
Hi everyone, my name is Guo Ling Yi. I'm from physics school and I'm a first-year medical physics student. In my group, my job is sculpture writer. Thank you.
My name is Tang Jia Hui from School of Physics, a first-year student majoring in medical physics. My job in this group is as a presenter. When it comes to cancer treatment, we always start off three major treatment methods, which is surgery, chemotherapy, and also radiotherapy. However, for patients with advanced cancer, they either lose the opportunity for surgery or are afraid of the severe side effects that chemotherapy and also radiotherapy brings to the healthy cells surrounding the cancerous cells. In this case, a new tumor treatment method, which is called hyperthermia, might just be the alternative that they can consider. In 1966, the German doctor Basch published an article for the first time about the benefits of heat in the treatment of tumors. He discovered this phenomenon from a patient suffering from a facial malignant tumor. After the tumor was removed, the patient fell ill with erysipelas, which is a bacterial infection below the skin cells. The disease induced a high temperature fever in the patient, but soon after, the tumor on her face disappeared. This led the doctor to the idea of using hyperthermia therapy on cancer patients. Basch's discovery made people find out and understood the impact of heat on the structure and function of cancer cells, and this event has made more people to be interested in hyperthermia. Nowadays, with the advancement of technologies we have, more research regarding this therapy has been made continuously, and it is slowly becoming a more popular option for cancer treatment as well. So, what is actually hyperthermia therapy and how does it work? The term hyperthermia is a combination of two Greek words, hyper, rise, and thermi, heat, meaning that it is a condition where a person's body temperature rises beyond normal level. Hyperthermia therapy uses the exposure of heat up to 45 degrees Celsius to the body tissues, achieving the result of damaging and killing cancer cells. So, how do we create the heat needed in the treatment? There are actually a few ways to create heat, including using microwave, radio frequency, ultrasound, or the method that we are focusing on today by using magnetic fields. For magnetic hyperthermia, we will first inject magnetic nanoparticles, such as magnetic iron oxide nanoparticles, into the tumor cells. Please note that the type of nanoparticles used vary with the target region because the amount of heat can be received by cells on different locations of the body is different. After being injected, the whole patient's body is placed in an alternating magnetic field produced by a magnetic field generator. This will cause the nanoparticles in the body to heat up, thus heating up the tumor cells as well, damaging and killing it in the process. We can see that after therapy is done, the tumor cells slowly shrink and disappear. Since now that you know how magnetic hyperthermia therapy works to cure cancer, now let us move on to the advantage and disadvantage of magnetic hyperthermia therapy. It is safe, painless, causes no surgical trauma, and there is no radiation to human body like radiotherapy. In contrast, the disadvantage of magnetic hyperthermia therapy is that some region of the tissue cannot withstand the even slightly higher temperature than the normal body temperature, not to mention the 45 degrees Celsius used in the therapy due to regional differences in tissue characteristics. This can result in burns, blisters, discomfort, or pain to the patient. By the 1960s, with the development of molecular biology and genetic research, people gradually began to analyze the mechanism of hyperthermia from the perspective of cell structure and function. With the development of theoretical research and clinical practice, hyperthermia has gradually been regarded as a kind of green therapy for cancer and has been applied to the treatment of various cancers. At present, hyperthermia has been applied in a small range in clinical treatment of some cancers, mainly as complementary for radiotherapy and chemotherapy. As of 2019, there are a total of 218 hyperthermia clinical trials under development worldwide. We expect that the development of hyperthermia will get better and better, bringing hope to cure more cancer patients and reduce the pain in the treatment process.